It's Speaking with Gravity, and I am Curvin.
I'm D.
And I'm Ty.
And we are a podcast that talk about mental health and how everything affects everything. You know, every episode, the goal is to have a conversation that makes you think, make you feel, make you do what's best for you. You see, when you sit with a therapist, the conversation is different. We are therapists, but this isn't therapy. It's a podcast. You know, we haven't been doing a disclaimer. We have not been doing a disclaimer lately. Do you want to do it now or you want me to do it?
You can do it because...
All right. While we serve as mental health professionals, the information and content being discussed during our podcast is not intended to be utilized or substituted as therapy or to represent African American culture, although we do represent that. The purpose of this broadcast is to share personal perspectives through open dialogue about various content based on our personal, educational, and professional experiences. Yeah, we've been skipping that, and I finally found a little blurb that we had put together, and I was like, we got to do that again. So, as y'all know, we talk about, to introduce the overall episode, we begin with like a Twitter discussion. And the one that I found this time was mental health is not a destination, but a process. It's about how you drive and not where you're going, which I thought it was pretty good. Now, the not where you're going part, I'm not necessarily too big on that. I think we all need to have some type of purpose, some type of goal. But in trying to get to that purpose and trying to get to that goal, you enjoy the ride. I've heard that so many times, and especially when I was younger, I got aggravated by that because it was like, But when I look back on things now, to enjoy the ride is probably, I wish I had done that more. As I was talking earlier, take pictures. I always tell people who have kids, take pictures. My oldest son is 16. Yeah, my oldest son is 16, and them 16 years go by real fast. So looking back at those pictures, it's like, oh yeah, he was that little at one time. Y'all have any thoughts on the Twitter discussions in general? This is gonna be Freestyle Friday now, so y'all jump in as I'm talking. Just jump in and say whatever you got to say. Interrupt me if you have to. QD of the hour.
QD of the hour, quotable data, which is another version of fun facts, information for you to be able to give your friends, colleagues, co-workers, church members. 1 in 4 of us will experience a mental health problem each year. 1 out of 3 go to treatment. Go without treatment.
Yeah.
So 1 in 4 of us will experience a mental health problem each year. So 1 in 4, but 1 out of 3 go without treatment.
It's 5 of us in this room right now. Of course, 3 of us, and then the 2 behind the scenes. So out of the 5 of us, 1 of us got a mental health problem. When you think about it like that, like it's real in the field. And then for people. It says 1 out of 3 go without treatment, but, if I had to say, I would say 2 out of 3 go without treatment. People and it's getting better. It's getting a whole lot better. But in general, people in the past have been hesitant to go to therapy. So that was an interesting fact. Episode intro.
All right, May is Mental Health Awareness Month. Shout out to all my mental health professionals. We want to shed light on what it is and what it ain't. Learning about mental health can help stop stigmas. We have so many battles to fight these days, so we must identify what is good mental health. The goal of this podcast session, especially in this episode, is to encourage you to get the help you need and or give the support that is needed to check in on those you love. What matters most is your mental health.
And again, as we're doing this episode, we're coming off the top of our head. There may be some triggers, so we don't know exactly where area we're gonna go in as I'm speaking right now. So just be cognitive of that as you're listening. We may talk about suicide. We may talk about trauma. There may be some triggers for you. Turn it off. If it's triggering you, if you think we're going in a certain direction, turn it off. And just, be mindful of your own mental health. That being said, where do I want to go with this? What is the best mental health advice that you've gotten? Best mental health advice that you've gotten or somebody's been giving it to you. For me, it's been the first thing that comes to my mind is self-care is saying no. Having the ability to say no. That's, you don't have to just go get your toes and your fingernails done, go get a massage. You could just say no. We have, as you stated already, we got so many battles, right? So many responsibilities as parents, as aunties, sisters, brothers. We got responsibilities. And to just say no and say, all right, I'm not doing it today. I haven't done this yet. It's my goal to, on a Saturday, to just not do nothing, just binge watch 1 or 2 episodes. I don't know why I can't get this out of my mouth today. Of something on Netflix or HBO Max or something. Because I don't get weekends off no more.
Oh.
I do revitalize, but I just don't get weekends off. Either I'm doing something for myself, I'm doing something for my family, or I'm doing something for my family. So I just want to just be at home and not do nothing. Wake up and binge watch a show or something like that.
So when do you plan on doing that?
When? Oh, man. Great question. What did they say about SMART goals? You got to have time as a part of that, right? So that's a goal of mine, but I don't never have a time associated with it. I say I'm going to do it, but I don't have a time associated with it. So you put me on the spot. When am I going to do that? Geez, I don't know. I'm probably going to have to, because you said that, I'm going to have to look at June. I'm going to take off somewhere in June because I got some stuff to do for the next couple of weeks for the rest of this month. So it's going to probably have to be in June. Yeah, I like that. You hit me with that one. Yeah, definitely got to put a time limit on it. So,
and don't let it be on Father's Day. If you choose to observe and honor Father's Day.
Oh, I definitely.
Okay.
I'm definitely gonna observe that. We observe Mother's Day every year and every day actually. So yeah, I'm gonna definitely take my days and my no presents that I usually don't get. I get a shout out. Thank you, Dad. Maybe a T-shirt with their handprints on them.
Okay.
At 15. Y'all still giving me that?
It's the thought.
Okay.
Okay.
Again, we talking mental health, right? I hate that. It's the thought that counts. No, don't give me a gift that you wanted, or don't give me a gift because you didn't take the time to think about, to get to know me. Like even if it's a child or in a relationship, all right. Think about the person you're getting a gift for. What do they do from day to day? What do they enjoy? My wife loves her sorority. I can play it safe every time. If I get her something for Z5B, I'm in there. All right. But I do try to go beyond that and think about what I can do for her. I don't want to just be like, oh, yeah, I'm your husband.
So it is the thought that counts. You put in the work to think about what it is that you want to gift the individual. But I understand what you're saying, too. It's the thought that counts, as we usually
If
say.
you thinking.
Right.
Don't just give me a necktie, even though, because I go to church. Don't just give me a necktie.
But you do wear ties, though.
I do, but it's got to be one that's on point. Don't just give me
Any type of
Don't give me a flowery necktie right now. I haven't worn flowers on my necktie since 91.
Oh, God.
90, 91, I think it was, when they had all the colors. That was probably before y'all time.
I mean, I was one.
You was born, oh my jeez.
Shout out to the 1990 babies.
90s baby. All right,
90s, true
y'all getting
90s.
away from me.
Yeah.
What's your best mental health advice that was given to you, either professionally or one-on-one?
I really really got a couple, so but I'm gonna keep it on the one track. I think the best mental health advice I ever got was, "You are the author of your book. Never let anyone else borrow your pen." And I don't know. That just said so much with me. Like, life is about your journey. Like, as much as it is about the people we love, as much as it is about our family, it's about you. And so, as you're writing the story of your life, like, you do have to be mindful of nobody else can tell your story. Like, nobody else can give definition to what you had to experience, what you had to endure, the good, bad, the ugly. So, like, that resonated with me, and that actually came from when I was working in the call center, and it was a customer who told me that at the end of a call, like, "You're the author of your own book. Never let anyone else borrow your pen." And I just, to this day, like, I still remember that. That's one thing that sticks out to me more than anything.
You said never let nobody borrow what? Your pen?
Your pen.
That's even, of course, the statement in general is powerful, but that part about not letting somebody borrow your pen, because people get in our head sometimes, you know, because everybody got their own advice, right? Or how you should do, how you should live your life, or how you should do the things that you want to do. I'm guilty of that too, because sometimes I see people that's younger than me. I'm like, "Hey, do this, do that,"
Right.
because I didn't do it, or I see where they have this avenue. But I have to think about it. Like, dang, man, am I trying to debo them and tell them how to live their life? And
I'm
so,
guilty
yeah,
of that.
yeah.
Unintentionally at times, but sorry.
And even when you were saying about is their life, they have their own experiences. What I see sometimes, we dismiss people. We don't validate. We don't validate their experience, right?
Right.
And everybody's experience and perceptions are different. Right? And it's valuable. Even though you say you're guilty of that, your thoughts are valuable. And what you give to me may be relevant. It may have me going home at night and be like, "Wait a minute, she said this." I don't know.
I guess with that, I'm just trying to learn to be mindful, not to offer unsolicited advice or suggestions. Be a listening ear when asked. But I know me, so that's why I say sometimes it's unintentional, but it still was intentional to that person. So just trying to be aware of how people ask me to show up when they are reaching out to me, So sometimes, not all the time, but sometimes I ask, okay, just a disclaimer, you wanted me to listen or you want me to give advice too?
Oh, you gonna ask them from the beginning.
Sometimes because I know me, and I don't intend to just offer suggestions and advice, because oftentimes I'm a solution-focused person, but that person may not be asking for a solution from me. They may already know the solution. They just want to vent about whatever they're experiencing, and I oftentimes have to pump the brakes and not, create a solution for them when it wasn't even asked in the beginning, or sought, after. So it's being aware of that.
Y'all think we get like that because we're mental health professionals? I know you say you're solution focused, but I do want to, when somebody come to me, I am thinking
right
at that moment, all right, what my response is going to be. I am listening.
Right.
I'm deciphering everything, but I know that my response is critical. Like, what I say is critical. Even if I just say, "Oh, man," I know that statement is going to be critical in that moment, or at least I feel like it's going to be. And so I'm thinking of a response. You think that's just because we're mental health professionals?
I don't know.
I think for me, yeah, I try to have that balance of turning it on and off, but I think that's just a part of my innate character, personality traits, whatever. I think it's just a part of who I am. All right, what are we gonna do?
Yeah, what we gonna do about this?
And try to include myself, to let you know that I'm here to help.
This is an alliance.
Yeah.
But just still being mindful of that, because sometimes people don't want you to do anything other than just listening, and that is doing something. Being attentive, as they're expressing things. But to answer your question, what's the best mental health or well-being related advice you've ever received? Like, D is so many, but I'm only going to focus on one, and this is popped in my head. I got this from a former mentor. Well, she's still a mentor, a former supervisor. Retreat, rethink, respond. There are different synonyms for each one of those words, but really, retreat, take a moment and step back, rethink as you're analyzing what just happened, and then respond. And in those moments of pausing, for one, you can initiate natural breathing techniques to calm the body down to help. I think it's the parasympathetic nervous system. When we're experiencing the fight, flight, or freeze, when the adrenaline is just rushing through your body, take a moment and step back, think about what just happened, and then go back to respond to the situation. And I try, of course I'm not perfect, but I try to implement that every day. I don't know how many times throughout the day. So yeah, retreat, rethink, respond. And as you're doing that, breathing, natural, slow breaths, or whatever your natural breath may be. But yeah.
Yeah, those deep breathing exercises. I ain't gonna even lie. At one time, I felt like they did not work, but they do. It helps calms you down. It helps the blood flow. But mostly, it helps calm me down. That's what I usually when I'm explaining it to someone. So now you can make a better decision, a more calculated, regulated decision, instead of just reacting because you slowed down. But yeah, I like that one. What is, if we had to define mental health, and I got mine right here.
Go.
If we had to define mental health to people, and we've done a couple of presentations together about this. I don't think we ever put it in a episode though. But what is mental health? And I feel like no matter how often we repeat it, there's going to be somebody out there that just don't understand it. People think of, again, I was speaking on this earlier. When they think therapy, they think, oh, you're going for depression, or oh, you're going for anxiety, instead of I'm just going for my mental health. I'm going for preventive measures. I'm going to deal with a crisis. So mental health, what is it, if y'all had to define it, and if I had to define it, it's just a combination of thoughts, feelings, and behavior. I'm a CBT guy. I'm a cognitive behavior therapy guy. So I think all of those go together, and just being aware of my cognitive and the thoughts, the feelings, the behavior. Being aware of my thoughts, my feelings, and my behavior makes up my mental health. They all go together. If I had to explain, that's what it would be. So if one of them is off, if my thoughts are more negative, more often than not, that's gonna change the way I feel about the world. And I even noticed that where if my thoughts are negative, I'll try to either do some self-talk.
Reframing.
What is it?
Reframing.
Yep, cognitive reframing. I'll listen at different music, so that my perception is different. So I can better my perception, I should say, because if I don't, if somebody say something to me, I'm gonna look at it negative. Like, say for instance, if yesterday I had some time, right? So if I'm having negative thoughts and I reach out to y'all and say, yo, I got some time, let's link up, and both of y'all say no, because of my thoughts are already negative, I'll be like, oh, they trying to avoid
me.
I'm an old head. They don't want to hang out with the old head. And, you just have to be, aware of that. But all of that is under your mental health. So, what is mental health to you, D?
Oh, darn, Garvey.
You're the one out of us that give the best definitions off the top of your head, and then they be accurate. They be on point.
I just stop doing that.
What you mean? Stop doing that.
I'm okay. When see, you throw me off guard. I mean, you throw me off track.
One time you was explaining it, and you was talking about an umbrella, and I was like, oh my God, I had never thought about it.
Yeah, we were giving a presentation at one point in time.
Yeah, I don't know if you could remember that one again. But I've used it. I can't explain it right now, but I've used it in a session about talking about an umbrella.
I think I know what you're talking about. I know. Yeah, you threw me off. threw my train of thought off. Let me
When we go to time.
yeah, go to time.
I mean,
swing
I was
back
going to
around.
say pretty much what you guys have said is kind of, I'm not going to repeat it. I think mental health varies for everybody, though. You've even shared this, D, which gave me the perspective. We all have mental health, just like we all have physical health. It's about managing it and ensuring that the mental and physical are balanced, if that makes sense. Yeah. But the actual definition, I'm going to let y'all have it because it's hard for me to define it. And I know some people, how is it hard for you to define mental health when you're a mental health professional? Because it is.
Yeah, and you know what? I think that's why I think that the more we get in tune with it, the more you see that it's not about defining what it is. I think it's the self-awareness of what it takes for you as an individual to have a holistic balance within yourself, whether that's spiritually, whether that's mentally, whether that's physically, whether it's financially, whatever aspect of it, you have to be able to find out what allows you to be at a place of contentment within yourself so that you can be the best person for yourself. Like when you, because if I can't show up for me, I can't show up for anyone else. So I got to be in a place where I can show up for me and be present within myself so that I can show up for you in the capacity that is comfortable for me, right? Because I can't overextend myself, because sometimes I think that's what happens. We overextend ourselves for other people,
Repeatedly.
and then we get off balance, and we're trying to get back into position with ourselves, but we don't want to abandon you now, right? Because now we've set these expectations. This is how I can be here for you, right? This is how I can support you. And it's getting to a place where you understand it. This is my level of comfort in how I support you, right? If you need something outside of that, then I may need to connect you with additional support. Like I've been working with myself and with my patients. Like you have to tell people, sometimes I don't have the mental capacity to handle what you're bringing to me. And that's what mental health is about. I have enough awareness in myself that I have so much going on right now that it's not I don't care about what you're dealing with. It's that I can't really process and help you through it because it's going to take away from it. And we've been taught, I think, that that's selfish, but it's selfish to actually push yourself down and push other people up, and then you don't even recognize who you are anymore. Like that's really, like, it's just, for me, and I think with mental health, that's what I'm coming to understand, is like you really have to have a great level of self-awareness about what it is that allows you to sustain your peace while supporting others achieve their peace, right? And that's kind of where I am with that. And it is a just like anything else. I think what you talked about was important. It isn't saying that I have depression or just waiting till I get to a depressive episode to go and seek mental health support. It's about saying, okay, I'm at a good place right now, but I notice this thing is a little bit challenging. I need support on how to navigate through this, because so that I can sustain where I'm at or even grow beyond that point, right? Because if I get to a situation where life has done hit me and knocked the wind out of me, it's gonna be hard to regroup. You know what I'm saying? It's about knowing yourself. I think about it even going to a boxing match, like how in boxing you see people just running around the ring and you like, they're not hitting nobody. But the whole time they're strategically doing what they're doing. They're tiring out their opponent. They know exactly what they're doing. To us, it look like they're not boxing. But they're really strategically doing this because they've examined this person's win. Like they're reading the room. And I guess I'm going too far. Talking too much. But you know what I'm saying? But that's kind of what it is. It's kind of like you got to be able to read yourself and recognize your own strengths and work from that perspective. Like identify the strengths within yourself and focus on that. Like you develop and you build your weaknesses, but focus on your strengths and take that and you use that to kind of build yourself up and sustain your mental health. Like that's what it's about, finding the strength within every situation that you have. And I think the biggest thing that I've learned about mental health too, and that's the second advice that I've learned for myself, is that the power of choice. People don't always understand that they have choices. Like you have a choice to do anything. You have a choice to do absolutely nothing. That's your right. You have a choice to do something good. You have a choice to do something that may not produce the outcome that you desire. in all things, we all have choices. And mental health and sustaining mental health is about the choices that we make and the information we utilize to make those choices.
Yeah.
That's why he said what he said earlier.
Yeah.
About you.
Yeah, you know how to break it down. You get to going and then you get to going.
Yeah, but I
You
ain't
done
mean
brought
to,
in
but
boxing there. I didn't even know you watched boxing.
Man.
But yeah, you definitely on point, man. And I think sometimes too, one of the things as you were talking about, when we press ourselves down, I think when it comes down to an intimate relationship, we can see that. We can see where, oh, I am not myself no more. I became my husband, my boyfriend, my girlfriend, whatever. But when we don't always look at it from a holistic standpoint, like of everything. So yeah, you definitely hit on a lot of key points. And when you said, what was that you said? Something about having the capacity to know that I can't do this right here, which led me to thinking about mental health days, right? How do y'all feel about it? All right, now I know that we need mental health days, but I still feel like there's a time and a place. There's rules, there's regulations. You can't just be taking mental health days for the sake of taking mental health day. You can't just. Well, I ain't gonna say you can't, but as a person in a leadership role, a business owner or a supervisor, I wouldn't want somebody to just wake up in the morning and say, "Oh, yeah, I'm calling in because I'm taking a mental health day." Like I still feel like there needs to be parameters around that. Going back to you saying that there's choices, right? Mm-hmm. If you need a mental health day, then what choices did you make to get to that point to need a mental health day where now you're going to put whoever you are obligated to or have a responsibility, you put them in a bind?
Well, the first person you're obligated to is self. So I think, you know. Oh, but you're saying like what leads up to you saying, you know, I got to choose me today.
If you're obligated to self, which you are, then that means you've done some stuff over the last 10 days, over the last 30 days, over the last 6 months to get you to the point where you need this mental health day. Now you are putting whoever you needed this, whatever responsibilities you had that day, you putting that at risk because you need a mental health day. You didn't take care of yourself prior to that, which goes back to us talking about not waiting until you got depression, not waiting until you get anxiety. With me saying all of that, I'm okay with the mental health days. I'm not okay with just taking them. I'm not okay with just saying, oh, we got unlimited time.
I feel like for me, that depends on the individual themselves. And again, it goes back to what Dee said, and I shouldn't have to really go into depth of why I may need a mental health day.
Not that you have to go into
No, but
depth.
I mean, but if I am a leader and my cohort of people who are following me or my colleagues or whatever the case may be, they may not ask, well, why do you need a mental health day just based off of, you know, privacy, and that's they say why they need a mental health day, then I'm just going to respect that. Whatever is tasks or things I was obligated to, I don't care at that point in time because I'm taking a day for me. I take them faithfully. Whether there are parameters around it or not, I don't care about that. I need a day. However, when it leads up to that point, I guess having that sense of self-awareness to know, okay, I'm not in the capacity to lead others today. I'm not in the capacity to fully show up for people who I may be working with. So I need time to regroup, you know, to get myself back together, whether that's just binge watching shows on Netflix, whatever the case may be, so that I can then go back into this place and show up for self in ways that I show up for self, as well as show up in the capacity that I feel I can show up for other people. But I do believe mental health days. And
I guess what I'm saying is you got sick days, right?
Oh.
You got 5 days. So to me, if you take those 6 days, that is mental health. Mental health can be a sick day.
But
So why do we need, like I see people say, we need sick days and mental health days.
I think that's why language is important though, because when people hear sick days, they think I have to be physically sick. People don't mind taking a sick day if they got the flu, if they got to go to the doctor, if they got to go whatever for a sick day. But what I think what we need to do, and it talks about, I think they need to change it from sick day to wellness, because wellness period is whether I got to go to the doctor, whether I need mental health, because in that form, now if I do need a mental health day, it is that, because what's the difference if whether I'm mentally sick or physically sick? Mm-hmm. If I have to call out that day of, regardless of who it's going to affect, I'm still calling out. That doesn't change what I'm doing. My thing of it is, I think you what you're talking about is, if I'm in a place that I know intentionally, okay, like I said, I'm going to take off on the 20th of this month, and I identify the 20th to be my mental health day. Then if that's my practice, then yes, I need to go ahead and work up until that point and prepare myself to be off for that day. So if I know it's an email that needs to go out, or I know it's information that needs to go out, I need to prepare myself to have done that. But if I wake up on the 18th and all hell has broken loose, I can't think, I can't sleep, I can't go to work, I can't be productive, and that's my wellness day, which mental health day, then that's just so be it. Because honestly, I wake up, you go to bed fine one night, the next thing you wake up, you got the flu. Like, what happened? You know what I'm saying? Mm-hmm. I went from my nose running to now I got a headache, got a fever, and all these things, and like nobody ever says anything mm-hmm. about it, right? Nobody says, oh, that's what it is. It's just like, oh, she was sick. Oh, okay. I wouldn't have came in either. But mentally, you there's some things you can't recover from. And like I had to tell a patient the other day, when you are physically tired, society understands, if I am physically exhausted, all I have to do is rest. To regain strength, to regain momentum, all I have to do is rest. When you are mentally exhausted, I don't care how long you lay there all day, that's not going to regain you. That's not going to revive you. That's not going to regroup you. There are things you have to actually do. You have to do something in order to rebuild mentally. So I think that's why you need that. I mean, I apologize to my supervisor, but if I got to be off, as soon as I got to be off, because here's what I do know. If something happens to me and I crack, you're going to put that position up to by 12:01.
Take care of yourself. We want you to get well. Take care of yourself.
Yeah.
I appreciate. I agree with the language. Wellness and
whatever
capacity that is, because I think oftentimes people don't understand mental and physical go hand in hand. It's a connection. When you're experiencing some type of physical illness, 9 times out of 10, that's just me saying 9 times out of 10. I don't know the actual number. You're experiencing some type of distress within the body. Mm-hmm. And typically that distress is caused from some type of being mentally overwhelmed, avoiding certain things, being unaware of certain things, which then could lead to physical health issues. And then even on the physical side, I'm hurting so bad now it's affecting my mental well-being, but I'll push that to the side because I feel like I got to keep going, or I normalize things, or I don't know, so I like the part where you said just switching that language. I'm just taking a wellness day, and whether it's physical or mental, so be it. I don't have to be sounding like I'm physically sick, or I can say just to say all of that.
I definitely like changing the lingo on it, the wellness day. I don't like adding additional days. I mean, if you add additional days, all right, so typically, it depends on wherever you at, but you're going to get 5 days, 6 days. If somebody, I could see you doubling that, maybe, but we can't be having like 20.
Why not, though? If I'm working 365 days out of the week, why can't I get 20?
You should not be working 365
Well, for some people,
days.
They may have to, though. I know it's circumstantial. That's the right word.
Yeah.
But if you're working...
you're not working 365, but some people, they may
7
work
days,
300.
5 days.
May work...
Yeah. If you're working 5 days a week, 6 days a week, 7 days a week, or if they're requiring you, well, they should not require you. That should be a law. They shouldn't require you to work 7 days a week. Some companies work 7 days a week.
And then some people pulling doubles, sometimes triple, just to make ends meet. We got inflation going on, and people livelihoods, and
even with that, like the double shift, the 7 days a week, then you need to change the culture of that particular company. Now, those wellness days, they need to be significantly increased, or you need to go tell that company, or the consultants need to say, nah, man, y'all can't keep doing this.
Well, 9 times out of 10, the consultants ain't the ones working them 7 days, double shifts. It's the other individuals who may either feel voiceless or just say, I've been doing it so long, I'm accustomed to it. Again, not in tune with I'm physically tired. I got on these steel toe shoes. I only get 2 15-minute breaks, and they expect for me
That's
to come in here
crazy.
7 days a week.
That is
To me,
crazy.
that's modern day slavery.
Yeah, that's crazy.
And then you want me to come right back in here and do the same thing. And granted, again, like you said, it's a choice. I choose to wake up every day to go to this establishment, to work for this company. But some people may feel this is all I have. But granted, again, I think that's where mental wellness, you do have a choice. You know, you may have to go through certain hoops to change the outcome of your situation, but you still have a choice. You can either get up and go to manpower that day, or you can get up and go back to the same place that's requiring this amount of time from you, that's causing the physical and the mental distress.
Or you can go to therapy on your mental wellness day so that they can tell you that you got a choice.
Indeed.
And I like what you said about if you're going to take that mental wellness day, you can't just be laying around or doing whatever ain't going to just fix it. You got to do something about
But
it.
it could be. It could be. I can't tell another person they have to, if your mental wellness day, because sometimes my mental wellness day is me just laying in bed because I've been on the go. It's what you need, right? Somebody else's mental wellness day may be they going to the gym, they going to the spa, whatever puts you at a place of contentment within yourself, that's what you do. It don't have to mirror what I do because I don't have to walk with you. And I heard you say something a while ago. You said nobody should be working 365 days physically. We work 365 days mentally all the time. That's what we really have to get into our mind frame. 365 days we do that mentally. Every day that you wake up, you going through mentally everything that you are enduring. Physically, I don't have to go to work. You're right. Saturday and Sunday, I don't go to my job. But Saturday and Sunday, I do think about everything that I'm enduring, everything that I'm going through. And so sometimes being able to be in a place where, you know what, I don't have to think about this right now, right? You know, I do get to enjoy my, put a ring on it or whatever I'm watching at that moment. You know, I do get to binge watch a show.
Put a ring on it?
Yeah, that's a show. And everything, like it's just, but it's whatever I enjoy. You know what I'm saying?
Yeah.
That's what I get to do. And we did have one of the other people in the room who wanted to say something. They just don't have a mic.
Oh, you come in. Now, no, if you're going to say something, you're going to come around here. You definitely got to get on the mic. Because, no,
you got to slide
you
over.
got to come on in. All right, so to those who are listening right now, we have I call him Young Garvey. What do you want to be called? You want to?
My name is Joshua Williams.
Okay.
I go by Garvey as well.
Okay. But he has his show. Can you tell a little bit about your show?
Yeah. They put me on the spot. I was just going to give a suggestion, but they called me up. So the platform that I have, Let's Talk About It. Really, it's not really a podcast, but it's like a platform where I go around asking random people questions, right? Questions that I feel and that my squad feels really gets to the soul. You know, really brings out deep questions. So they really make people think. You know, that's the goal, is to make people think, make people reflect, and hopefully someone who needs that information will see it and be able to apply it to their life. Just like we're doing today.
Yeah.
With this podcast.
So and then he was here just kind of watching what we do, seeing if we can collaborate at some point. But you had a suggestion that when you was over there.
Well, yeah, I was just gonna say, since a lot of times when you take sick days, a company may require you to bring in an excuse. Bring in like a doctor's notice.
Yeah.
I know you touched on. Both of y'all kind of touched on. When you do take a mental health day, you need to do something, right? You need to do something. So, I mean, I would think a happy medium for both parties would be a company, having a mental health person on hand, having maybe a therapist on hand. So when that person does want to take a mental health day, not trying to, I don't want to, control the way they handle their mental health. Don't want to do that, but having those parameters in place, I think, and saying, okay, when you do have a mental health day, when you need, when you're going through some things, I need you to talk to this person. I feel like it's a happy medium, you know what I mean? And it can, it can work against that person's, I would say, their mental freedom, to handle their mental health. in the way that they want. But think about it. I mean, when you have a sick day, I want you to go to the doctor because I want to know that you're really sick, right? And I almost feel like that'll kind of, I just feel like
it'll balance it out.
Yeah, like it's a good happy medium.
Yeah.
You know?
And I think I was coming from that standpoint too, because different jobs are gonna require you to do different stuff. When I worked at UPS, right, there's kind of like an assembly line, so everybody that is there is important. Now, granted, if one person decides, or not decide, but if one person need a mental health day, I can cover that one person, maybe even cover 2 people, maybe even 3. But out of, what is it, like 12 people on the line, in Greenwood, it was like 12, 15 people. When you start getting like 5 or 6 people out at one time, that's going to be difficult. And then that's where his happy medium comes in at that, okay, somebody's not just taking advantage of it. And granted, it's always going to be somebody that takes it granted. But when you have the assembly line, when you have that person, multiple people at one time, trying to take these mental health days, that affects the company.
The company pockets.
It does, but it also affects it affects the company pocket, but it affects your pocket, because if that company don't make money, then the person who is there for their livelihood can't make money. Not only can that person not make money, but maybe they can't get a raise next year because they wasn't able to put their product out. I mean, it's everybody, again, going back to me talking about, or not me, but you alluding to it. We're not validating each other. I know the company is a company, but the company is started from a person. And then that person worked with other people. We have to validate those people, even though they're in a position of power and they're giving me the money and I'm aggravated by that. They have their own feelings.
But I think you're talking about a person operating in integrity, right? I think that's more about integrity. Okay. That's not mental health. My integrity means I'm not just laying out because it's what I want to do. Knowing the difference. It's a difference between laying out of work and taking a mental health day. Mental health doesn't necessarily indicate that, oh, I just didn't feel like going to work today, so I just didn't go. Mental health means that I'm practicing self-awareness, meaning I'm doing the work to know that I can't physically show up because of the spacing I'm in to perform a job. Because here's the other task. I can come to work, be at work all day and do absolutely nothing because I'm not in the spacing to perform myself, right? So you're paying me at that point to be there to do absolutely nothing. How many people go to work every day and did absolutely nothing on that job today but sit at a desk?
I've never done that.
Sit on the line.
My entire life.
I can tell you there's been some days that I went to work and did absolutely nothing because I wasn't in a spacing to be there. So honestly, I took a mental health day, but the only thing was I had to physically be in a place that I wasn't able to perform the mental health work because I'm still there like, man, I know I should really be working, but I just couldn't get myself to wrap around it. So I did become more intentional. Okay, if I'm going to go in there and not do nothing, that's the same thing. Either if you're talking about it from a losing money way, I'm losing money if I show up to work and do absolutely nothing. That company is losing money if I show up to do absolutely nothing. It's unproductive because now I done got written up because I came to work and wasn't doing what I was supposed to do. All right, now I done got further behind. I mean, so it's about being intentional and operating integrity and being realistic about where you are. I think when people don't understand mental health, if you think mental health is just, oh, I just get to lay around and do nothing all day, then you're right. Maybe you shouldn't be taking a mental health day because you don't understand what mental health is. It's when you have an understanding that I'm doing this because this is what I need to be doing, not because I went out Friday, Saturday, and Sunday and knew I had to be at work on Monday, so I just called in. That's not mental health. That's a lack of prioritization. And you got to understand, in order to be able to go out Friday, Saturday, and Sunday, you had to have money. So you need to be at work on Monday. You see what I'm saying? That's what we talking. Those are two different spectrums. And I think you have to be able to decipher that. Everyone doesn't operate in this same amount of integrity. And what we went back to earlier, have to know the power of choice. When you make a choice to take a mental health day, you have to understand that it may come with a consequence. Your company could come back to you and say, you've missed too many days, you're inconsistent in this process. We need someone who can show up a little bit better. And if you may have to accept what that looks like. You know what I'm saying? Or they may come to you and say, hey, you've been out a lot. We may need you to go and talk. You have to, what's kind of going on with you. And then they may refer you to their HR staff or their mental health staff or whoever. You have to be able to be in alignment with that, right? Mm-hmm. To set yourself up for that. But I think at the same time, it's all about that self-awareness and that self-worth. It doesn't excuse the personal accountability that we have for ourselves and to others to actually be and operate in a sense of moral integrity. And that nobody's gonna change for you. That don't matter what you're doing. I think that's just a person.
And I think too, like what you're saying, thank you. We appreciate it. We appreciate it.
We appreciate it. How can they find you?
Thanks for having me. Yeah, so I'm on my YouTube channel, Joshua Garvey Williams. Also on Instagram, you can find me at Garvey, 4, Prez. So at Garvey, 4, Pres.
Okay.
Yeah.
There's a whole lot. We're gonna have to put that in the show notes.
I think too, definitely what he's saying. We do have these things in place, like EAP. A lot of companies offer EAP programs. However, I can't speak for every company, but oftentimes there are companies who contract with agencies who offer counseling or mental health services, but how effective are they? And then, too, if we're talking about company-individual relationship and ensuring that the people who we hire are able to come in and perform at the rate they're able to perform at, and as well as meet our standards, then we need to have daily conversations about overall wellness management, whether that's in a break room posting things or every other meeting that we have, we're reiterating how to manage wellness, how to identify, you know what I'm saying, when there are things that are causing ill management or issues within our own bodies or whatever that leads to us, I need to take a mental wellness day or just an overall wellness day. So I think it goes on both ends, but like you say, acting in integrity and just being intentional about your mental well-being. If I'm just saying I need a mental wellness day and I ain't even intentional about it, then that's something you're going to have to deal with, individually, because what's going to happen is you're going to need another mental wellness day. And it's like, what did you do the first time when you needed a mental wellness day? And if you needed to lay down, that's cool. But while you were laying, were you still being intentional about, all right, how can I continue to better myself if I experience this again? Yeah. So, but yeah.
I'm not, just for clarification, I am not saying we don't need mental health.
Right.
I just wanted parameters around it because I'm looking at it from both sides, not just the individual side, but the people who are relying on you to do a job or a duty. But I love what you're saying about having some material that's sent out, some material that's posted, and having people to actually come in and have discussions about it so that, we always talk about this. We always say, that's the whole point of this podcast. Conversation stimulates growth, and education stimulates growth in us as individuals. So, and then shout out to Deacon Tim Brown at my church. He had a conversation with me, and he was saying, man, mental health is big because at his company, the job that he works at, they have actually brought a mental health counselor on. I don't know what company it is, but that mental health counselor is there for the whole plant, and you can go in and you can talk to that person. So I don't know what company that is, but that's really big for them just to hire a person just to do that.
Netflix did that recently too. They it was like a director of wellness. I think that was the title of the position. But I think as society continues to normalize mental well-being, companies continue to normalize mental well-being, then we're normalizing the conversation about either eustress, which is good stress, or distress, within the body. So I think normalization, validation, not being dismissive will help, I think, gravitate people more towards, it's not that something's wrong, but am I feeling a little out of balance, or is it something going on that I don't even know? Let me go talk to somebody about what I may not know that I'm describing, or feeling, or whatever the case may be.
And when you said dismissing, man, we got a group text when that young man died, Kevin Samuels, and different people was like, they were saying the stuff that they were saying is like, he's still a human being. If I'm not mistaken, he has a child or children. I'm pretty certain he's a father. So he's somebody's father. He's somebody's son. He's somebody's brother. and it's like good riddance. Like, dang, that's rough. We dehumanizing somebody. We're dismissing their existence, and he had a role to play in the world. Whatever that role was, he played his role in the world. We need to acknowledge that. But that being said, we're talking about mental wellness. We're talking about mental health in general. How can we? What are some things that we can do to maintain mental health, good mental health? What are some things that we can do to strengthen mental health? And we've already said some stuff that you can do to maintain it. You can say no. You got self-care. You can take your a mental health day. What can we do to strengthen it? And I'm trying to think as I'm asking y'all this question. I'm thinking to myself, what can I do to strengthen it? For me, connections. Connections are big, and I don't think we realize how big those connections are. I hear people say to me sometimes, "I don't like people." I would venture to say they do like people. They just don't like the people that they are around in that moment or at that time. Connections are really big. Having people that are like-minded, people that love you, you love them. That's a type of energy that they're giving off that you're going to need to counteract the bad energy that we do find in the world from time to time. So having those strong, healthy connections with family members, with good friends, and so on and so forth. So that's what I would say for strengthening mental health. Y'all got anything?
I think for me, it's just always mindfulness and practicing mindfulness, being intentional about what you're being mindful about. No judgment, but really being in tune with self. Your mind is going to wander, and then that's okay. But just being able to use the breath as the anchor to bring yourself back to the present moment in time. And as you continue to do that, it will become a little easier. But of course, with everything else, repetition, being consistent with it and just learning to be present in the present moment, not worry about the past, not worry about the future, which can lead to anxiety, or diagnosis of anxiety, because oftentimes we're anxious. Everybody gets anxious, but there's a difference, and I know Dee will shed light on it. There really is a difference. But just being mindful, and I think once we practice mindfulness and being kind to self, I think a lot of things will then shift. And I'm just speaking from personal experience, trying to show up for self and being kind to self, because oftentimes I've gotten so accustomed to negative self-talk that it's just become a daily practice. So subconsciously, that's what I gravitate towards. And I think in the past, I've treated others that way unintentionally, but I know how I can come off. Those who may know me like, all right, Ty, but they know me. But for those who don't know me, it could be perceived in the wrong way. So it's like, all right, you got to be a little kinder to yourself, because how you treat yourself sometimes is how you treat other people. And I'm not a negative, bad person or anything, but I know it's some work that I have to do. So being mindful, for me, every day, every minute is important to help me get grounded. That retreat, rethink, respond is real. But yeah, just being mindful, being present, and being grateful for where you are, and not being so judgmental on self, and understanding you got the power of choice. So if I don't like something, what can I do about it? I'm in control of my life. I'm the author of my life, nobody else. And if I give that power to somebody else, then we need to come talk to somebody, whether that's you engaging in natural remedies, whether you choose the traditional path of talking to a traditional psychotherapist, whether that's you implementing, again, yoga, mindful techniques, because we oftentimes need to tap into the body too, because that's where people experience dissociation. I can talk to you all day, but if my feelings are I still have no connection with self, I'm just talking just to be talking, but I still have those feelings, that I can't describe or that I can't get in tune to. So I think I just got off topic. But yeah, it's mindfulness. And having a cohort of people, who understand you. But you first got to understand yourself before you can try to ask somebody else to understand you. So having inner standing, I think. But yeah.
What about you, Dee?
I think it's a collaboration of everything y'all said. I think the greatest thing is practice daily gratitude. I think you remember to be grateful for even the simplest things, it can change your perspective on, everything. Like, some days I shout out to Carolina Health Center, who I currently work for. There are a lot of things that they do intentionally, especially my director Jessica Jacobs. I mean, she's just phenomenal in checking in with people and just making sure people are in a good space, and I think it allows me to be able to practice gratitude for myself. Working in a health setting that you work in where you see people coming in daily sick, you start to appreciate even the simplest things. I don't know how many people I see coming in walking on a cane, and I'll be like, man, I feel bad for them. But then I see somebody else come in and they're in a wheelchair. You know what I'm saying? And like that changes that perspective. So it's just like, be grateful for every transition that you have. And then I even think about that person in that wheelchair, they still have a life. Then I think about that person that just got that message that their loved one just died. You know what I'm saying? So it's always being in a constant state of gratitude. As worse as it is for me, it could be 10 times worse. And it potentially is 10 times worse for someone else. And so this is how it helps you to come out of that self. And you have to be intentional with that practice. And it's hard. It ain't no easy walk sometimes to be in gratitude. But the more you practice it, the better you become at it. And the more you realize, even in my storm, I'm still blessed because I'm able to be in the storm. Like, I'm getting a chance to go through and experience this. And no storm lasts forever.
I love us. Because we just gave, we gave just three things real quick, like that people can implement into their life, like connections, mindfulness, and gratitude. Like, you can do that. Now, granted, this is not therapy,
Right.
but these are things that you can do in your day-to-day life, and you have to be intentional about that. Like, and I tell people all the time, you have to be intentional. If you're going up against depression, if you're going up against a crisis in your life, you said earlier, if you're battling like negative self-talk or whatever, then you have to be intentional about what you're doing. And these are at least three things that you could do to do that. But along those lines of connections, like, so I'm gonna do two things before we end.
I think our guest wanted to add something else.
You gonna have to pull up a chair. Come on, bring on the chair.
Just say, real quick.
No. You messing up you messing up our decor. You got to get the black chair. You can't just be. Yeah. You done denied him. And we're gonna have to have you on for a whole episode too. You can't just be popping in and popping out.
I love y'all. I just want to say real quick, man, deal with your trauma. I want to say real quick.
You got a trauma expert right beside you.
And that comes being mindful also plays a lot into that. But you got to deal with your trauma, that baggage that you're carrying around. I feel like you got to assess that. You got to look at where this comes from, the trauma, the baggage that you have, and how it's affecting you. A lot of times we can't properly, I feel like, assess our mental health because we can't be as kind as we would want to. Sometimes we can't even be ourselves because we got that trauma that's holding us back. You know what I'm saying? Things that we've gone through, times where maybe, just we might not have forgiven ourselves for some things or forgiven other people, and we may have to do that a lot of times before we can really get to a place, where we need to be and where we can be more grateful. You know what I mean? And have that gratitude that we're speaking about. I just think that's really big, is dealing with that trauma, that baggage that you're carrying around. You might not even know how you affecting people, how you speaking to people. And I think everybody really spoke very well and spoke to that. You might not even know, you might not even be aware, might not even have that awareness. So dealing with your trauma is it's just very important. Can't stress that enough. That's all I wanted to say, though. I ain't going to interrupt.
No, you're going to stay right there. Get the mic back to her, but you're going to stay right there.
Definitely.
And if we need you to chime in, or if you want to chime in, you'll be able to chime in. So I got two more points before we end. We're talking about different things that people can do. And these two things that I want people to really take away from this episode, we kind of hit on. And those two things is your support system, and then accepting your accomplishments of what you've done up until this point. So we're gonna do this. We're gonna show them how to do it. With their support system, I want y'all to think about who you love, like who you want to send love to for something that they done for you. And of course, you're gonna say your baby, your son, but it could be more than that, right? But for me, oh man, I done said I didn't even have one right off the rip. But who am I sending love to? I'm actually gonna say I'm gonna send love to my family and my friends, and that might sound like, oh, he took the easy route, but my support system really hold me down. I got a group of friends that are like crazy, right? We have we have a chat. I got a group of friends that I do fantasy football with, and we all mad different. And I don't know. I do know they listen to the podcast. I don't know if they're gonna listen to this episode, but they keep me grounded. They ain't gonna let me get a big head. They're gonna shine on me from time to time. But then they also respect what I do for a living. But it doesn't surpass who I am, and I'm still curving to them. I'm still, depending on what year it was, I'm still Curve Gotti to them. Yeah. That was my name back in undergrad when I was doing all the good things that a young man would do when he's in undergrad.
Do a lot of good to get
Yeah.
a name like that.
But they keep me grounded, and then my family, my mom, my brothers, my sister, and I love my sister to death. She's pursuing her degree, and I think she's going to end up being a therapist. I would like to think I influenced her, but she's a natural, really. And I just, they really hold me down. Of course, I have my wife and my kids, but, it's a difference between my siblings and then my friends. I get like a different type of energy with them, whereas with my family, my wife and my kids, I feel like I have to be the good energy that I'm pouring into them more so. But that's who I'm sending love to, my family, sisters and brothers, my mom. Shout out to my dad who's deceased, and then my friends. All right. So who y'all sending love to? Who y'all support system? Who y'all love?
I'm sending love to everybody. No, I'm just kidding.
Everybody in the whole wide world.
Everybody
Okay.
need a little love. But most importantly, I'm sending love to first and foremost you all. I think I can't negate, the influence and the correlation that this relationship, this duo, creates. I love how, we don't got to stay in the chat every day talking about nothing, but just the intermediate check-ins and getting together is like, especially because we understand the profession, we understand our roles, we understand what we do. Like, I can text y'all and go off in a text message, and y'all might not even say nothing back, but I know y'all understood the message, and I know y'all have experienced that moment, and it's like they know what I'm talking about, and like I can't share that with anybody else. So I definitely appreciate y'all. My brother, most definitely. Shout out to him. My sister, my best friend, Lacey, Kanisha. Honestly, like I said, my supervisor, my mentor, Miss Bird, Miss CC. It's just a lot of people, that I think God has placed in my life who serve different purposes, and I'm just grateful for each and every person in my past, in my present, and those who I have yet to meet, who I just really appreciate and value, because I feel like every person really is beneficial. So who I love all y'all, because really every person that I've ever interacted with has ordained me to be exactly who I am, where I am now. So yeah.
Shout out to Miss Bird. I don't know her like that, but shout out to Miss CC too, because I would not have met y'all if it wasn't for her, and her establishing the place that she had in Synergy Counseling, where it went from just her to where it is now with multiple counselors and psychiatrists, NPs, all that she's got out there. But I've met a lot of people in that process and working there, especially y'all too. So shout out to CC.
I mean, it's going to be the same. Everybody who's come across my path and who's still on my path with me, I can't thank you enough. You've either taught me something about myself or taught me something about you that I may want to incorporate in my life. So thank you. That's from family, friends. I ain't got enemies, but people I may not care for. Seriously, you know. Of course, y'all following the group of friends. Like, really, y'all. I appreciate everybody who's just had an opportunity to meet me and who I've had the pleasure of meeting and sticking around. I may not say it often, but I am grateful and I'm appreciative. So thank y'all. Anybody who listens, from Ty to you, thanks.
Young Garvey.
Grateful. Thank you.
Who you love? Who you love? Who you send in love to? Who's been in your support system?
I like that grateful word. I've been on grateful lately, so I want to. I'm sending love to, and I'm grateful for, my mom. Mother's Day just passed. Grateful for my mom. Can talk to her about anything. My dad as well. Can talk to him about anything. When you got parents that you can really go to, it's so important. So I'm challenging all the parents out there. Be those type of parents. That's supportive. Just want to say that. Also, my daughter, my kids are so, it's crazy. They're almost like me. They're so gentle. You know what I mean? They can sense when, how somebody might be feeling. My daughter, she'll just touch me sometimes. Like she's a trip, when I'm feeling, and she just lets me know that she's there. You know what I mean? And that's great. I might not even be feeling down, but it's just the fact, she just wants me to know. She'll just touch me, She's just gentle like that, And I got some good friends, man. Shout out that boy Dan. Shout out Dre Moss. Shout out Jordan. Shout out all my boys. You
gonna forget
High Class.
You keep on.
Doug. 4-5. Shout out T. Shout out all them boys, right? Shout out the crew, the members. But I have some really good friends. Some friends that are really there for me. I cherish them because I cherish relationships. We was talking about connections earlier.
Yeah.
I cherish people who are true, people who are real. I don't think you can get enough of those people in the world. So and that's what I'm grateful for. That's what I love. I love everyone, but so, I can go on all day, but I won't.
You're not gonna do that.
Though. I do got to shout out my son's grandparents, Leroy and Gwendolyn.
Leroy.
Yeah, Leroy. Don't play with him.
Okay.
But they family. I love them with my whole heart.
Hey man, look, I got. My bad, man. Shout out my aunts and my uncles as well. I gotta shout them out. I feel bad if I didn't. Just always been there, supporting me through, college, just after college, with my kids. Just super supportive. So shout out. Yeah.
When you were saying the grateful thing, if we're not careful, we'll look at all the people that wasn't there for us, and then we'll forget about all the ones who were. Like as we're talking, we're like, okay, I remember this person, I remember that person.
I said everybody.
Yeah. But we have to be intentional about those people who have impacted us in a good way, and quit focusing on. Like Ty used to say, I ain't got enemies. Maybe people that don't like me or I don't like them. But we got, quit putting the attention on them and put more of it on the people who have been there for us. So last thing, we kind of went a little long with this episode, but it's our last one for the season, right? Celebrating yourself. I have this thing about, all right, just think about what you have done, what you have accomplished. When we talk about anxiety, we worry about if we're going to be this, if we're going to be that, or if that's going to be able to happen. We don't know how things are going to work out. But they've worked out to this point, right? And so we have to be willing to accept what we've done to this point. Celebrate our wins is what I like to say. So what wins have you had either this week or this year? What wins have you had this week or this year? Anybody can chime in as I'm thinking about my wins this year. What wins did I have this year, this week? What week this is? What have I done?
Oh, no, it's quarter 2.
Yeah, it is quarter. It is quarter 2. Dang, I've done a lot. Jeez.
Man, my wins this week is that I showed up every day, any
Okay.
day. I showed up. You know, a couple times I was getting ready to chuck deuces, but I showed up, and so that's my win. The win for this year. You know, I'm still in the win, so I don't think it's completed. Part of it is, you know, just learning how to accept people for who they are. You know, continuing to work on myself, continuing to kind of establish goals for myself, being involved in my supervision, working towards growing professionally, mentally. So yeah, I'm winning every day.
Okay.
Yeah.
I'm more consistent. I've become more consistent this year than I've ever been in the past. That person that's, you know, I procrastinate. I get my deadlines in, but I've been more consistent going ahead of the game this year, business wise and personally. I'm one of those people that pay his light bill before I have to pay.
Yes,
I'll wait
yes,
until I
I know.
have to, but now I'm ahead of the game now. And then Do Energy, don't call me out if I'm not ahead of the game right this very moment. But yeah, I am. I've been more consistent, and I got paneled with Medicaid. I
Awesome.
finally got that complete and done. Well, the ones that I want to be paneled with. So that was a real big win for me, business wise.
And business is growing.
Mm-hmm. Yeah, it's definitely growing.
Yeah.
Definitely growing. So shout out to that. All right, Taisha.
I was gonna say I don't know.
Oh, you know.
Honestly, no, seriously, because I'm trying to think. All right, what wins have I had?
You secured 2 deals with 2 campuses.
Didn't your business start this year?
Yeah.
Well, yeah. See, that's what I'm saying. This is me working. I don't mind speaking. I am in therapy too, so working on, you know, really being grateful or just patting myself on the back or praising myself for the things that I often overlook. But I guess this year, my sister and I, we started a 360 video booth company, and we were able to secure 2 big contracts with 2 local high schools in our area for their prom, and I think that's going to continue to open up more doors. So, I mean, I guess that's a win. It is a win.
And
I'm
a
not going
yoga
to say
class?
guess.
Your yoga.
Yeah. See?
Yeah.
Having yoga classes when I choose to. Honestly, I'm still working on that. My own individual practice as I try to guide other people. I don't want to be a fraud, but really, you know, I got to be consistent with my own practice before I try to guide others on their individual paths. Just consistency, working on positive self-talk. It's a journey. So, yeah, every day is a win. Honestly, when I get to wake up, you know, that's a win. I'm here. So I got another opportunity to manifest and create something that I want for myself each and every day. So, yeah, life is good.
Oh yeah. Young Garvey. What's your wins?
I'm gonna get right back to. I want to ask you, what does yoga do for you?
For me personally, it is doing, because it's something that's ongoing. It continues to bring about self-awareness with self. Honestly, gratitude. I speak a lot about breath work because it's so important, understanding that the breath itself, pranayama, I mean, it gives life force. It guides everything. If we don't have oxygen, then what?
Yeah.
You know, that's any living thing. So you need breath and understanding how to breathe correctly, and just awareness, being present, not being judgmental. That's one of the things I'm learning. Not to be judgmental towards self. It's not even directed towards anybody, but I'm so hard on myself that oftentimes, like this question, what are your wins? I don't really know. So just trying to not be judgmental, be grateful, practice love, really loving self more, and just having love for each and everybody and every single thing, even this. You know what I'm saying? Just loving the beauty of it. Thank you. Yeah, so that's what it's teaching me. because I'm still learning as a student and a teacher. So, yeah.
I just wanted to ask that. I actually took a yoga class in college. It was just on the. It was one of the electives I had. So I took it. I was like, because I mean I was into psychology anyway, so I've heard similar things about it. I didn't take that class as serious as I wanted to though. So I want to get into it now though as I get older. I think that'll be dope. So yeah, definitely that's great. So yeah, wins. I want to say this year I got a little better with my goal setting. I feel like, and I think that helps you to identify your wins better too, right?
Yeah.
Because your wins are then intentional. I'm trying to get to this place. But so I got better with my goal setting. I left some things behind. I let go of some things. That's big, y'all. That's big. Like this, I was like, I lost some things, but intentionally, you know, I let go of some things, which I feel like was great. You know, I started this show. I do call it a show. Let's talk about it with myself and my cousin, Grind, and we've been doing that for only about a month and a half now. We're on episode 4. You know, so that's going up, reaching a lot of people. And I'm just identifying things in my life that, you know, I'm identifying, I feel like my journey a little, you know, in a way that I want to. You know, I'm still, I feel like I've allowed God, you know, to hopefully be navigating for me to a little more. And to me, that's a big win in itself, too. Yeah, I don't want to go too deep, but yeah. So I've had some wins this year. Yeah.
All right, so young Garvey, we're gonna have to have you back as an official guest. This was unofficial. This was informal. I don't know. I like this episode.
I really like this.
Yeah.
I like this.
I think y'all did great. Yeah.
This group right here.
Yeah.
Group dynamic.
So we definitely gonna have you back. Hopefully we'll get started in August of this year. I'm putting that out here now. Because sometimes we'll wait and we're not going to do that. That's going to be our goal. We're not going to wait. But we hopefully we'll get back in August and bring you on. I'd love for you to be the first guest.
Okay.
For the next season. That'd be season 5 for us. Don't know what we're going to talk about as of right now, but appreciate you coming in, stepping in, and adding to what we presented today, adding to the energy. And you've already told them where we can find you at, but y'all look forward to that. Did y'all have anything y'all want to say, Ty, D, before we end?
Again, I appreciate y'all. Curvin, I appreciate you giving me an opportunity to be a part of this platform. Thank you. It is continuing to push me outside of my comfort zone. Just continue to practice patience, kindness, love, and live. Really live. Whatever that means to you, but live. And that's it. Y'all be good.
All right. Now you got to say something. She did that. She give us some parting words.
Man,
because they ain't going to hear from you until August. They need to hear.
I think I said enough. Just, again, be kind to yourself. In everything that you do, be kind to you, be kind to others. And, if you're in need of help, seek help, seek support. There's strength in numbers, and sometimes we can't do it alone.
Okay. She gonna jump on me at the end of this episode for keep putting her on the spot like that. You're not gonna jump on me?
Because I don't know what you're talking about.
Okay. Now they're public. All right. So subscribe to Speaking with Gravity on Facebook and Instagram. We'll make it easy for you, and we'll put it in the show notes. If you need a resume update,
don't hit me up because I'm actually on hiatus. I'm taking a break, self-practice and self-care. I'm not doing reservations right now. I do apologize. But I will refer you to a Community Connect, Miss Shamika Elmore, who has professional development business. So that's where I'm directing a lot of referrals to her. Okay. And for all your event needs, 6-1 Event Rentals, they still out here doing their thing. And we'll link that in the show notes as well. I have a monthly wellness group for BIPOC, men or people of color, 4th Monday of the month. That's with Gravity Counseling Group.
We also want to shout out Mr. Winston for coming
Always.
through,
Thank you.
being behind the scenes. You check him out on winstonjstewart.com. And that's for not just audio and production of like a podcast where he does photos. That's his main thing. Let him tell it. But I think he's good at all of it. But check him out. Check out his website and reach out to him if you need anything. And that's gonna wrap it up for us on season 4. This was it's getting better. Like it's getting. I feel like it's getting easier. And it's just I really enjoyed today. But thank y'all for being here. Thank y'all for thank y'all for being here to be a part of this. And thank you that are listening for taking the time to listen. You could be doing anything in the world, but you chose to listen to us, and we appreciate that. And remember, we are therapists, but this isn't therapy. It's a podcast.